There's a specific moment a lot of people over 60 know well. You're sitting in a chair, you go to stand up, and instead of just standing, you find yourself rocking forward, maybe pushing off the armrest with both hands, maybe needing a second try. It happens fast, and most people brush past it without thinking twice. But that one moment is actually telling you something important about your body, something walking alone won't fix. For years, the standard advice for staying active after 60 has been simple: walk more. And walking is genuinely good for your heart, your mood, your circulation. I'm not here to talk you out of walking, but if walking is the only thing you're doing, you're missing the piece of the puzzle that actually determines whether you'll be steady on your feet, able to get off the floor if you fall, and living independently 10 or 20 years from now. That piece is leg and hip strength, and the single best way to build it without equipment is something you're already doing dozens of times a day without realizing it's exercise. Standing up and sitting back down. Done with intention, that movement, the chair squat, does more for your long-term independence than walking ever will on its own. See this come up constantly in practice. Someone walks 3 miles a day, feels proud of it, and then needs both hands on the armrest just to get up from a low chair. They're not lazy, they're not out of shape in the way they think they are. Walking is a forward motion activity. It moves you across the ground, but because one foot is always touching down, your body never has to lift its full weight against gravity the way it does every single time you rise from a chair. That's the gap. And it's a gap that quietly grows wider every year after 60 if nothing addresses it directly. Anyway, let's talk about what that gap actually looks like in daily life, because the signs show up long before anyone calls it a problem. You might notice you've started using the armrest out of habit, not because you decided to, your hand just goes there automatically now. Some people notice it on stairs, where going down feels riskier than going up, because going down asks your legs to control your weight instead of just lifting it. Others notice it getting out of the car, needing a beat to gather themselves before standing all the way up. A lot of people tell me their legs feel tired standing in a checkout line in a way that has nothing to do with how far they walked that day. And there's one more that almost nobody mentions until I ask directly: turning around quickly or stepping sideways to avoid something and feeling that flash of unsteadiness. Sound familiar? None of these are dramatic. That's exactly why they get ignored. But they're early signals from the same source. The muscles around your hips and thighs aren't being asked to do enough, and your nervous system's sense of balance is quietly going untrained right along with them. Lose strength, lose balance, lose confidence in your own steadiness. That's a triple whammy, and each piece feeds the other two. This matters more after 60 than it would have at 40. Starting around your 60s, muscle is lost faster than it's rebuilt, unless something actively challenges it. That's sarcopenia, the medical term for age-related muscle loss, and it doesn't announce itself with pain. It just shows up later as difficulty doing things that used to be automatic. The CDC actually uses a version of this exact movement, the 30-second chair stand, as part of its steady fall risk screening for older adults, because how many times someone can stand up and sit down in 30 seconds turns out to be a remarkably accurate window into their risk of falling and their overall functional independence. That's not a marketing claim, that's a clinical screening tool used in primary care offices. This is part of why physical therapists increasingly use sit-to-stand performance as a marker of someone's functional age rather than relying on the number on a birth certificate. Two people can be the same chronological age and have very different functional ages, and a big part of that difference comes down to how much they've kept their hips and legs loaded against real resistance, not how many steps they logged that week. Used to tell patients that walking was probably enough on its own. I was wrong about that, and the data on sit-to-stand capacity changed my mind. Walking supports a fraction of your body weight at any given moment. A chair squat asks your thighs, hips, glutes, and core to lift your entire body weight against gravity, every single repetition. That's real resistance training, and it's the kind of loading your muscles and your nervous system need to keep their strength and their coordination, not just their endurance. Loaded muscle does something else too, contracted under real resistance, and it releases signaling proteins called myokines into your bloodstream, with effects on inflammation and blood sugar control elsewhere in the body. Walking triggers some of this. Loaded movements like a chair squat trigger noticeably more of it. There's also a balance piece that I keep coming back to because people tend to underestimate it. Falls are one of the biggest threats to independence after 60, and a single bad fall can change someone's life within a few seconds. The chair squat trains exactly the skill your body needs to recover from a low position, slowly, under control, with the chair right there as backup the whole time. Every controlled rep is your nervous system practicing the thing it would need to do in an emergency, in an environment where the worst case outcome is sitting back down, not falling. So let's get into how to actually do this safely, because the technique matters more than the number of reps. Sit toward the front edge of a sturdy chair, nothing on wheels, nothing soft, with your feet flat on the floor, roughly shoulder width apart. Keep your chest lifted and your eyes forward rather than down at your feet. Lean your torso forward slightly from the hips, press through your heels, and stand up slowly. Don't rush this part. At the top, stand fully upright without locking your knees back hard. Then reverse it. Bend your hips and knees and lower yourself down under control until you just touch the chair, then go right back into the next rep if you're doing more than one. If you need your hands on the armrests at first, use them. That's not cheating. That's where you start. Breathing matters here too, and it's a detail most people skip. Breathe out as you stand up. Breathe in as you lower down. That pattern helps stabilize your core and keeps your blood pressure more even through the movement, which matters if you've ever felt lightheaded standing up too fast. On numbers, start with whatever you can do with good form and zero pain. For some people, that's 3 repetitions. For others, it's closer to 10. A reasonable target to build toward is performing the movement, slowly and with control, for about 30 seconds straight, once a day, most days of the week. That's it. After a couple of weeks, once that feels manageable, you can make it harder without adding any equipment at all. Lower yourself over a slow 3 count instead of dropping down normally, or pause for 1 second just above the seat before sitting. Small changes like that ask more of the same muscles without changing the risk profile of the movement. I want to be honest about something here, because it's the part people get wrong. This isn't about turning into an athlete, and it's not about doing it perfectly. I rarely see someone improve their fall risk and their day-to-day mobility without addressing leg strength specifically. Almost never does walking alone move that needle on its own. But I also rarely see someone stick with a new exercise that feels like a chore. So the trick is attaching it to something you already do without thinking, right before brushing your teeth while the kettle's heating up, during the first commercial break of whatever you're watching. 5 reps, twice a day, tied to an existing habit, will outlast a more ambitious plan that depends on remembering to do it. The confidence side of this is easy to overlook. People who feel unsteady tend to quietly shrink their world, skipping the uneven sidewalk, avoiding the stairs at a friend's house, turning down an outing because getting in and out of a car feels like more trouble than it's worth. That's not something anyone decides on purpose. It happens gradually, rep by rep in reverse. Rebuilding the strength tends to reverse that same pattern just as gradually, and most people notice it first in small, almost boring ways, standing up without thinking about it, not grabbing the counter on the way to the sink. Now, a few mistakes worth flagging because they show up often enough to mention by name. Rushing the movement is probably the most common one, using momentum to rock yourself up instead of controlling the lift, which trains very little and raises the chance of losing balance on the way down. Holding your breath through the effort is another, and it's an easy habit to fall into without noticing. The breathing pattern from earlier helps break it. Some people also push depth too early, going all the way down to a low, soft chair before their knees or hips are ready for that range. If anything in your knee or hip feels sharp rather than just tired, you back off the depth, not the exercise itself. And one I see a lot, stopping the very first time it feels hard, mistaking normal muscle fatigue for a sign something's wrong. This isn't carelessness, and it's a completely understandable instinct if you've spent years being cautious with your body. But fatigue in the muscle you just worked is different from pain in a joint, and learning to tell those two apart is part of what makes this safe to keep doing. And comparing your pace to someone else's, especially someone who's been doing this for years, is its own quiet trap. There's no version of this where speed matters more than control, and the person doing 5 slow, perfect reps is getting more out of it than the person rushing through 15. If you have significant joint pain, a recent surgery, or any condition your doctor is actively managing, talk to them before starting this or any new movement. They know your history, and that conversation is worth having before you begin, not after something goes wrong. Before you go, here's the short version. Walking is still worth doing, but on its own, it doesn't load your muscles the way standing up against gravity does, and that loading is what protects your strength, your balance, and ultimately your independence as the years go on. A few slow, controlled chair stands, most days, tied to something you already do. That's a small habit with an outsized effect on how steady and capable you feel 10 years from now. Everything in this video is for educational purposes only. Always consult your doctor or healthcare provider before making any changes to your health routine. If this was helpful, give it a thumbs up, drop a comment with your question, and subscribe if you want more like this.